Irritable bowel syndrome is a common gastrointestinal disorder. It may affect 15% of Americans. It affects women more than men, and it's a functional problem, not a structural problem with the intestines. People with irritable bowel syndrome may experience abdominal pain. They often complain of bloating, fullness, and a change in bowel habits. The changes in bowel habits may include constipation or diarrhea or both. The symptoms may be mild or severe. They can occur intermittently, infrequently, or very frequently at various times. There's no clear answer as to the cause of irritable bowel syndrome. There seems to be a communication problem between the nervous system and the intestines. There are times when the bowel may contract too forcefully or not forcefully enough. Contributing factors may include environmental factors, food intolerances, hormonal activity, or bacterial activity. Irritable bowel syndrome is not caused by stress. It is not a psychiatric or psychological disorder. However, emotional stress may contribute to the onset of symptoms of irritable bowel syndrome. People who are anxious or nervous may experience increased symptoms of irritable bowel syndrome. There's no single test that can confirm the diagnosis of irritable bowel syndrome. A careful history and physical examination by a physician is essential to make sure that a more serious disorder is not the cause of the symptoms. Irritable bowel syndrome is not a serious or life-threatening condition. Relief of anxiety or stress may be helpful in alleviating some of the symptoms. Ways to do this may include biofeedback, physical therapy, or relaxation techniques. Also, lifestyle changes such as regular exercise or improved sleep habits may be helpful. Dietary changes may help patients with irritable bowel syndrome. Use of a food diary may help shed light on certain foods that can trigger episodes of irritable bowel syndrome. Probiotics or good bacteria may help to ease the symptoms of irritable bowel syndrome. Patients with moderate or severe symptoms may also benefit from the use of certain medications. Irritable bowel syndrome in and of itself does not lead to more serious problems. It doesn't cause bleeding or cancer or inflammatory bowel diseases. However, if your symptoms persist or worsen in any way, it's important to contact your physician. Further testing may be necessary to be sure another more serious problem has not developed. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. They have completed advanced surgical training in the treatment of these diseases, as well as full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. They are well versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and they are able to perform routine screening examinations and surgically treat conditions if indicated to do so.